Every 40 seconds, someone in the United States has a stroke. But here's what most people don't know. Up to 80% of strokes are completely preventable. That means right now, as you're watching this video, you have the power to dramatically reduce your risk of one of the leading causes of death and disability worldwide. I'm going to share with you the 10 most critical risk factors that increase your chances of having a stroke. Backed by decades of medical research from institutions like the American Heart Association, the World Health Organization, and major clinical studies published in leading medical journals. More importantly, I'll show you exactly what you can do about each one of them. Before we dive in, let's quickly understand what a stroke actually is. A stroke occurs when blood flow to part of your brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Brain cells begin to die within minutes. There are two main types: ischemic strokes, which account for about 87% of all strokes and happen when blood clots block arteries leading to the brain, and hemorrhagic strokes, which occur when blood vessels in the brain burst. The good news is that understanding these risk factors gives you tremendous power over your health. Research from the INTERSTROKE study, published in The Lancet and involving over 26,000 participants across 32 countries, identified the key modifiable risk factors that account for the vast majority of stroke risk worldwide. Let's explore each one. The first and most significant risk factor is high blood pressure, also known as hypertension. The American Heart Association calls this the single most important treatable risk factor for stroke. When your blood pressure is consistently elevated, it puts extra strain on your blood vessel walls, making them more likely to become damaged, narrowed, or to rupture. Studies show that people with high blood pressure are 4 to 6 times more likely to have a stroke than those with normal blood pressure. What makes high blood pressure particularly dangerous is that it's often called the silent killer because it typically has no symptoms. You could be walking around right now with dangerously elevated blood pressure and feel perfectly fine. The only way to know is to check it regularly. Normal blood pressure is less than 120/80. Readings consistently above 140/90 indicate hypertension. The encouraging news is that controlling high blood pressure can reduce stroke risk by up to 40% according to research published in the Journal of the American Medical Association. This can be achieved through lifestyle changes like reducing sodium intake, increasing physical activity, managing stress, limiting alcohol consumption, and when necessary, taking prescribed medications exactly as directed by your healthcare provider. Our second major risk factor is diabetes. People with diabetes have a stroke risk that's 1.5 to 3 times higher than those without the condition, according to data from the American Diabetes Association. Diabetes damages blood vessels throughout your body, including those in your brain. High blood sugar levels over time lead to atherosclerosis, the buildup of fatty deposits in arteries that can block blood flow or rupture. What's particularly concerning is the rapid rise in type 2 diabetes globally. The World Health Organization reports that diabetes prevalence has been steadily increasing, largely due to lifestyle factors we can control. However, managing diabetes effectively can significantly reduce stroke risk. The key is maintaining good blood sugar control through proper diet, regular exercise, medication compliance when prescribed, and regular monitoring of your hemoglobin A1C levels. Research published in the New England Journal of Medicine shows that for every 1% reduction in A1C levels, there's approximately a 10% reduction in stroke risk. This demonstrates the direct relationship between blood sugar control and stroke prevention. The third critical risk factor is atrial fibrillation, commonly known as AFib. This is an irregular heartbeat that affects millions of people worldwide. When your heart doesn't beat in a regular rhythm, blood can pool in the heart chambers, forming clots. If these clots travel to the brain, they cause what's called a cardioembolic stroke. People with atrial fibrillation have a 5 times higher risk of stroke compared to those with normal heart rhythms, according to studies published in Circulation, the Journal of the American Heart Association. AFib becomes more common with age, affecting about 9% of people over 65. However, it can occur at any age, and sometimes people don't even know they have it because it can be intermittent or cause subtle symptoms. Common signs of atrial fibrillation include heart palpitations, shortness of breath, fatigue, dizziness, or chest discomfort. If you experience any of these symptoms, especially if they're new or recurring, It's crucial to see your healthcare provider for evaluation. An electrocardiogram or ECG can detect AFib, and if diagnosed, there are highly effective treatments available. Anticoagulant medications, often called blood thinners, can reduce stroke risk in people with AFib by up to 70% according to clinical trials. The key is working with your healthcare team to find the right treatment approach for your specific situation. Our fourth risk factor is smoking, and this includes both traditional cigarettes and newer forms of tobacco and nicotine products. Smoking approximately doubles your stroke risk according to extensive research published in multiple medical journals including Stroke, the official journal of the American Heart Association. Smoking damages your cardiovascular system in multiple ways. It accelerates atherosclerosis, increases blood clotting, raises blood pressure, and reduces the oxygen carrying capacity of your blood. Even exposure to secondhand smoke increases stroke risk by about 30% according to studies from the Centers for Disease Control and Prevention. Here's the incredibly encouraging news about smoking. Your stroke risk begins to decrease almost immediately after you quit. Within 1 year of quitting, your excess stroke risk is cut in half. After 5 years of being smoke-free, your stroke risk is nearly the same as someone who never smoked. This rapid improvement shows just how much your body wants to heal itself when you give it the chance. If you're currently smoking, quitting is one of the most powerful things you can do for your health. There are more resources available now than ever before, including nicotine replacement therapy, prescription medications, counseling services, and support groups. The key is finding the approach that works best for you and not giving up if your first attempt isn't successful. The fifth risk factor is physical inactivity. Research consistently shows that people who are physically inactive have a 25 to 30% higher risk of stroke compared to those who are active. Physical activity benefits your cardiovascular system in numerous ways. It helps control blood pressure, improves cholesterol levels, helps manage weight, enhances insulin sensitivity, and strengthens your heart. The Physical Activity Guidelines for Americans, developed by the Department of Health and Human Services based on extensive scientific evidence, recommend at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, plus muscle strengthening activities on 2 or more days per week. But here's what many people don't realize. You don't need to become a marathon runner to get these benefits. Even modest increases in physical activity can make a significant difference. A study published in the Journal of the American Heart Association found that people who walked briskly for just 30 minutes 5 days a week reduced their stroke risk by approximately 30%. The key is consistency rather than intensity. Taking the stairs instead of the elevator, parking farther away from destinations, going for walks during lunch breaks, or doing household activities like gardening all count toward your daily activity goals. The important thing is to move more and sit less throughout your day. Our sixth risk factor is diet, specifically diets high in sodium, saturated fats, and processed foods while being low in fruits, vegetables, and whole grains. The relationship between diet and stroke risk has been extensively studied, with research published in journals like The Lancet and the New England Journal of Medicine showing clear connections between dietary patterns and cardiovascular health. High sodium intake, common in processed and restaurant foods, contributes to high blood pressure, which, as we discussed, is the leading stroke risk factor. The American Heart Association recommends no more than 300 milligrams of sodium per day, with an ideal limit of 1,500 milligrams for most adults. Diets high in saturated fats and trans fats contribute to atherosclerosis, the buildup of plaque in arteries that can lead to stroke. Meanwhile, diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in nuts, seeds, and fish have been shown to reduce stroke risk significantly. The Mediterranean diet has been particularly well studied for stroke prevention. A landmark study published in the New England Journal of Medicine found that people following a Mediterranean-style diet had a 30% reduction in cardiovascular events, including stroke, compared to those following a low-fat diet. This eating pattern emphasizes olive oil, nuts, fish, fruits, vegetables, legumes, and whole grains while limiting red meat and processed foods. The seventh risk factor is obesity, particularly abdominal obesity. research shows that people with obesity have a 22 to 64% higher risk of stroke compared to those with normal weight, according to studies published in Stroke and other cardiovascular journals. Obesity contributes to stroke risk through multiple mechanisms. It's associated with high blood pressure, diabetes, high cholesterol, and sleep apnea, all of which are stroke risk factors themselves. What's particularly important to understand is that it's not just total body weight that matters, but where fat is distributed in your body. Abdominal obesity, measured by waist circumference, is particularly dangerous. For men, a waist circumference greater than 40 inches, and for women, greater than 35 inches, indicates increased health risks, including stroke. The good news is that even modest weight loss can make a significant difference. Studies show that losing just 5 to 10% of your body weight can lead to meaningful improvements in blood pressure, blood sugar control, and cholesterol levels. The key to sustainable weight management is combining regular physical activity with a balanced, calorie-appropriate diet rich in nutrients. Our 8th risk factor is excessive alcohol consumption. The relationship between alcohol and stroke is complex because the research shows both risks and potential benefits depending on the amount consumed. Light to moderate alcohol consumption, defined as up to 1 drink per day for women and up to 2 drinks per day for men, has been associated with a slight reduction in ischemic stroke risk in some studies. However, heavy alcohol consumption significantly increases stroke risk. Drinking more than 2 drinks per day for men or more than 1 drink per day for women increases the risk of both ischemic and hemorrhagic stroke. Heavy drinking raises blood pressure, can cause atrial fibrillation, and increases the risk of bleeding in the brain. Binge drinking, defined as consuming large amounts of alcohol in a short period, is particularly dangerous and can acutely increase stroke risk. If you choose to drink alcohol, moderation is key, and if you don't currently drink, there's no need to start for health benefits as these can be obtained through other lifestyle choices. The 9th risk factor is sleep disorders, particularly sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, leading to decreased oxygen levels in the blood and disrupted sleep patterns. Research published in the American Journal of Medicine shows that people with sleep apnea have a 2 to 4 times higher risk of stroke. Sleep apnea is often underdiagnosed because many people are unaware they have it. Common signs include loud snoring, gasping or choking during sleep, morning headaches, excessive daytime sleepiness, and difficulty concentrating. If you or your sleeping partner notice these symptoms, it's important to speak with a healthcare provider about sleep testing. The good news is that sleep apnea is highly treatable. Continuous positive airway pressure, or CPAP therapy, is the most common and effective treatment. Studies show that people with sleep apnea who consistently use CPAP therapy can reduce their stroke risk back to normal levels. Other treatments may include oral appliances, lifestyle changes like weight loss, or in some cases, surgical procedures. Our final and 10th risk factor is chronic stress and mental health conditions, particularly depression. Research published in journals like Stroke and Psychosomatic Medicine has shown clear links between chronic stress, depression, and increased stroke risk. Chronic stress can lead to behaviors that increase stroke risk, such as smoking, overeating, physical inactivity, and poor medication compliance. Additionally, chronic stress and depression have direct physiological effects that increase stroke risk. They can raise blood pressure, increase inflammation in the body, affect blood clotting, and contribute to the development of other cardiovascular risk factors. A study published in the Journal of the American Heart Association found that people with depression had a 34% higher risk of stroke compared to those without depression. The mechanism appears to be related to increased inflammation, changes in blood clotting, and the tendency for people with depression to have other cardiovascular risk factors. Managing stress and mental health is therefore an important component of stroke prevention. Effective stress management techniques include regular physical activity, meditation, deep breathing exercises, adequate sleep, maintaining social connections, and, when necessary, professional counseling or therapy. If you're experiencing symptoms of depression or anxiety, it's important to speak with a healthcare provider about treatment options. Now that we've covered all 10 major risk factors, let's talk about how they often interact with each other. Many people don't have just one risk factor in isolation. For example, diabetes often occurs alongside high blood pressure and obesity. Smoking can worsen the effects of high cholesterol and diabetes. Sleep apnea can contribute to high blood pressure and weight gain. This interconnectedness is actually encouraging because it means that positive changes in one area often lead to improvements in other areas. When you increase your physical activity, you're not just reducing your risk from inactivity. You're also likely improving your blood pressure, helping with weight management, enhancing your sleep quality, and boosting your mood. The concept of cumulative risk is important to understand. The Framingham Risk Score and other cardiovascular risk calculators used by healthcare providers take into account multiple risk factors simultaneously, because having multiple risk factors doesn't just add to your risk, it multiplies it. However, this also means that addressing multiple risk factors simultaneously can have a dramatic positive impact on your overall stroke risk. Let's talk about some practical strategies for managing these risk factors in your daily life. First, work with your healthcare provider to identify which risk factors apply to you. Regular health screenings can detect conditions like high blood pressure, diabetes, and atrial fibrillation before they cause symptoms. Know your numbers: blood pressure, blood sugar, cholesterol levels, and body mass index. Create a comprehensive prevention plan that addresses your specific risk factors. This might include medication management for conditions like high blood pressure or diabetes, lifestyle modifications for factors like diet and exercise, and behavioral changes for habits like smoking. The key is to make changes gradually and sustainably, rather than trying to overhaul everything at once. Focus on building healthy habits that address multiple risk factors simultaneously. For example, preparing meals at home allows you to control sodium and fat content, while also potentially reducing stress and saving money. Regular walking or other physical activity helps with weight management, blood pressure control, stress reduction, and sleep quality. It's also important to understand that stroke prevention is a long-term commitment. The benefits of healthy lifestyle changes accumulate over time, and consistency is more important than perfection. If you have a setback, such as missing exercise for a week or eating poorly during a stressful period, the important thing is to get back on track rather than giving up entirely. For those who have already had a stroke or what's called a transient ischemic attack or mini-stroke, aggressive management of these risk factors is even more crucial. People who have had one stroke have a significantly higher risk of having another stroke, but this risk can be dramatically reduced through proper medical care and lifestyle modifications. The field of stroke prevention continues to evolve with new research and treatments. Recent studies have highlighted the importance of factors we're still learning about, such as air pollution exposure, inflammatory markers in the blood, and genetic factors. However, the 10 risk factors we've discussed today remain the most important and modifiable factors for the vast majority of people. Technology is also playing an increasing role in stroke prevention and detection. Wearable devices can monitor heart rhythm and detect atrial fibrillation, smartphone apps can help track blood pressure and medication compliance, and telemedicine makes it easier to maintain regular contact with healthcare providers. These tools can be valuable supplements to traditional medical care, but they don't replace the need for regular medical evaluation and professional guidance. As we wrap up, I want to emphasize that stroke prevention is one of the most powerful examples of how much control you have over your health outcomes. While we can't control factors like age, gender, race, or family history, the modifiable risk factors we've discussed today account for the majority of stroke risk in most people. The research is clear. Implementing lifestyle changes and working with healthcare providers to manage medical conditions can reduce stroke risk by 70 to 80% or more. This isn't just about adding years to your life. It's about maintaining your quality of life, your independence, and your ability to enjoy time with loved ones. Remember that every positive change you make matters, regardless of your age or current health status. It's never too early to start focusing on stroke prevention, and it's never too late to begin making beneficial changes. Your brain, your family, and your future self will thank you for the steps you take today to protect your health. If you found this information valuable, I encourage you to share it with friends and family members who might benefit from learning about stroke prevention. Knowledge truly is power when it comes to protecting your health, and together, we can work toward reducing the devastating impact of stroke on individuals, families, and communities worldwide.